Well, hello.
So I know the last time that you were here, we talked about how you had a childhood, or you had a fear of dogs resulting from when you were bitten as a child, and so ever since then you have um, this anxiety that whenever you're around dogs, that you just have a hard time. You try to get away from them, and the reason why you've decided to come to counseling is to overcome that fear. You have a neighbor that has moved in next door to you that has a big dog. I believe you said it
I've got
was.
some friends too that have dogs, and I don't go visit them because they have dogs, so it kind of hurts the friendship a little bit too, because can't go see them.
Okay.
I'm afraid of their dogs.
Okay, and so you want it, and the reason why you're in counseling is because you want to overcome those fears.
Yeah.
Okay, so since the last time we talked, I was thinking that we would try something called exposure therapy. And so what that is that we would gradually introduce you to different things with dogs to where you would get comfortable with them. In this process, you have the opportunity to, if you're not comfortable, we can stop. But the whole purpose is to kind of get you more comfortable and to get over some of the fears and the irrational thoughts that you might have relating to that. The exposure treatment is focused on your environment that helps that helps decrease your fear when you're around dogs. At times it may be uncomfortable or unpleasant. And some of the homework assignments I may give you may be a little bit challenging for you because especially you're not used to being in that environment and your first instinct might be to run and get away from that environment, but just do your best that you can to try to stay and work through those different things that I have you do. Many clients have had some benefits from exposure therapy, so I think it would benefit you to try this as an option. And then, do you have any questions?
No, I'll try.
Okay. And if there's things that you don't feel comfortable with, we'll back off and we'll take it from there. You're in total control of this process that we're doing. So you are willing to try the exposure therapy. Okay. So when you're around dogs, how do you the fear that you have? How would you say? Would you say that it's a very scary situation? Like, how do you feel when you're in that situation when you're around dogs?
Panicky.
Mm-hmm.
Just real pain. My heart starts racing because I'm afraid the dog's going to know that I'm scared of it and it's going to turn and bite me.
Mm-hmm.
So I get real panicky, I guess is
Okay.
a good way of explaining how I feel. Real shaky. Just want to turn and run. But yeah, just uncomfortable.
Okay. And so you have that fear of being bitten again, basically going back on that past experience that you had before. There's an exposure hierarchy, and so on one of the things that you like, holding a dog is a huge, you'd risk that as like something that you just cannot do. Like, it's just not possible for you to do. Have you ever gone to a pet store and or?
No.
No? Okay. You steer clear of that? Okay. So one of the things that I'm going to ask you to do is I know we had talked about this in other sessions about relaxation, breathing in and breathing out when you're stressed or going through an anxiety situation. And so whenever you are feeling stressed, make sure that you're breathing in and breathing out, counting to 5. Okay. One of the things that I'm going to ask you to do in this session today is I have a dog toy. It's not going to hurt you, but I want you to just hold it in your hand and see, how you feel, if is it going to be something that stresses you out, or how do you think it will make you feel?
I'm not afraid of toys, so I don't think it'll no, I think it'll be fine with
You think
that.
it'll be fine?
Mm-hmm.
Okay.
Yeah.
Okay, so, let me grab that.
Oh, yeah, no problem. Yeah. Mm-hmm.
So, that is good. Okay.
Oh, it's a squeaker toy.
So, no fear with that one. You're good.
Okay.
Wow, you're doing great.
Yeah, I'm good with that.
You are doing great. All right, so I have another thing for you.
No, I'm going to do commercial for...
Well, so that doesn't make you nervous.
Nah.
Okay.
No, it's just a bag with some No, I'm good.
Okay, so you're good on that one. Okay. I'll put that over there on that desk for me. Okay. So, if I brought a dog in here,
No.
how would you feel? How would you feel if I held the dog?
You can do, yeah, you better hold on to that little bugger.
Okay. Will it stress you out if I bring a dog in here?
No, maybe a little bit.
Okay. Okay. Let me. Okay.
Keep
No?
that,
No?
Keep that dog away from me. Yeah.
Yes.
You don't want to try to pet him?
Mm-mm.
No?
No.
What do you think is good? So you think he's gonna bite you?
Oh yeah.
How about if you just pet his back? I'll hold him and you can pet his back.
Good bit, Jerry.
Oh, there you go.
Oh,
That's
he's
good.
giving me the evil eye.
No, he's not giving you the
He's
evil
giving
eye.
Bug eye. Little devil. Yeah, that's close enough.
That's close enough?
Yeah.
Okay.
Yeah.
All right. So,
Good boy, Jerry.
when I brought him closer, how did that make you feel?
I'm nervous.
Okay. And so, what feelings did you have when I brought him closer to you?
Real panicky, like he was gonna bite me.
Okay. But did he look like he was gonna bite you?
Got buggy eyes. A little freaky looking.
Those are eyes that said he wanted to be your friend.
I think so.
Okay. So, on a scale of 1 to 10, 10 being you're most scared, and 1 being not so scared.
Oh, maybe an 8.
Okay, an 8. All right. So if I were to ask you to hold him, how would that make you feel on a scale of 1 to 10?
No.
Is that a 10?
10,
Okay.
10. No.
You couldn't hold him?
No.
So, all right. So one of the things I was going to ask you to do is, do you feel comfortable? Well, wait, let me back up. I'm sorry. How do you feel now that he's not in the room?
Much better.
Much better on a scale of 1 to 10? 10 being the scaredest? You feel more on a 1?
Yeah.
Okay. But you were fine with the doggy treats. That was a 1.
Yeah.
The toy was a
They
1.
hurt me. Yeah.
So it's just the actual dog.
Yeah.
Okay. Do you think it's possible that he wouldn't bite you, or do you just have this fear that he's always going to bite you?
Yeah, he's gonna bite me.
Did you practice your breathing exercise?
No.
Okay. So that's something we need to work on.
Yeah.
Okay. And then, if he didn't have any teeth, would you still have the fear that he would bite you?
No on me. No on me.
It wouldn't hurt. It's just gums. Do you need a moment? It's okay. The dog's not in the room anymore.
I'll be okay. Okay.
He's not gonna bite you. He's not gonna bite you. It's okay. It's okay. Most clients have a fear of dogs biting them, but really dog bites are not as common as you would think. A lot of times you just gotta give them their space, let them smell you. So, do you need a moment?
No, good. I'm good. I'll be fine.
Okay.
Doing my breathing exercises.
All right. So, So we're a little ahead of ourselves. Holding the dog and petting the dog is too much right now. I get that.
Yeah.
So we won't go there yet. How would you feel about, I know you avoid the pet stores. How would you feel about going to a dog park where it's a fenced in dog park?
Yeah, as long as I'm on the other side of the fence.
Right, and the dogs can't get to you.
Uh-huh.
Would you feel comfortable, or how would you feel on a scale of 1 to 10? 10 being the scaredest, 1 not being as scared.
Maybe a 5.
A 5.
They can always jump the fence.
Well, most of the time they're on leashes,
They can break the leash and get away.
so your fear is that they're going to break the leash and get to you?
Mm-hmm.
Okay. Do you think, I know probably 10 minutes is too much, but maybe at least 5 minutes going to the dog park, hanging outside the fence just to,
Yeah.
if anything, I want you to observe how the dogs interact with the owners and the owners interact with the dogs. And so, but 5 minutes, 5 minutes at the best, okay?
Okay.
So you think you could do this homework for me?
I could try.
Okay, so before you go to the dog park, will you do me a favor and record how you feel? Because I know you'll be nervous and a little bit scared, but record how you're feeling. And then also I want you to, while you're there, remember the experiences that you're having. Like, are you feeling very nervous? Are you feeling very scared? But stick with it. I want you just to, they're not going to get to you. They're in a fence. And then how you feel once you leave the park. Did anything happen? Did everything, is the worst that you imagined? The worst that you could possibly imagine, of course, them jumping the fence, breaking the leash, biting you. Did that actually happen? And that sort of thing. I'm very excited. You did a good job letting me bring him in the room, even though you were a little nervous about being with him. Do you have anything else that you want to discuss about?
Nope.
Nope.
Oh,
All
I'm good.
right. All right. So just work on that homework assignment, and then I will see you next week.
Okay.
Okay.
Uh,